Hello and welcome to the Apex Healthcare Reform Alert webinar, How to Calculate and Pay PCORI Fees. Today we'll cover what is PCORI, who pays when, how to calculate PCORI, how to submit your payment, and actions you should be taking right now. What is PCORI? PCORI is an acronym that stands for Patient-Centered Outcomes Research Institute. An ACA set aside fees to help patients, payers, and the public make better healthcare decisions. And this will be done through advanced research. And this research will evaluate and compare health outcomes and clinical effectiveness data and the risk and benefits of two or more medical treatments for services. Who's responsible to pay PCORI? First of all, plan sponsors and health insurers. Who else is responsible? Well, if you have a self-insured plan, you are the carrier, of course, and you will pay. And for those of you that purchase fully insured coverage from a carrier, your health insurance issuer will pay the PCORI fee on your behalf. Now, obviously, you will pay it ultimately in the form of administrative fees that will be passed down through the carrier to your bottom line. Other responsible parties. Multi-employer plans, the Board of Trustees is considered the plan sponsor, and they will be responsible to pay the fee. MEWAs, the MEWA committee is the sponsor, and plans maintained by two or more employers. The name that is on the plan document will be the responsible party to submit PCORI. Plans that pay the PCORI fee, yes or no? Government entities, generally yes, they'll be responsible to pay PCORI. Stop-loss carriers will not need to pay PCORI. Dental and vision plans generally are accepted benefits and will not pay. FSA, EAP, MSAs, and HSAs will not need to pay the PCORI fee. Now, there could be an exception on the FSA. We'll cover that in a moment. If your HRA plan is offered along with a fully insured medical plan, you will need to pay a separate PCORI fee on the HRA. If your HRA plan is offered with a self-funded medical plan, no, you will not need to pay a separate fee on your HRA. However, make sure that your plan documents show both the medical plan and your HRA having the same plan year. There remains one last standalone HRA, and that is the HRA for retirees, and they will need to pay the PCORI fee. Here's an IRS link that would have a complete listing of every type of plan that must pay the PCORI fee. Now, that note on FSA. A health FSA is an accepted benefit, therefore doesn't have to pay PCORI if the employer also offers a non-accepted minimum essential coverage package to the employees. Also, the maximum benefit of the FSA must be equal to or less than 2 times the salary reduction election, or if greater, $500 plus the amount of the salary reduction. So, the FSA is accepted if the employer does not make any contributions to the FSA, the employer makes a dollar-for-dollar match to the FSA, or the employer contributes no more than $500 to the FSA. When to pay PCORI? PCORI fees are due July 31st of the year following your plan year. PCORI started with plan years ending on or after October 1 of 2012. PCORI will end with your last plan year that ends prior to October 1st of 2019. Plan years and due dates for PCORI. Here's a chart. It shows the policy year for which the PCORI fee is due. Then moving to our right, again always July 31st, and the following year your PCORI fee will be paid. Year 1 is $1. Year 2 is $2. And then subsequent years your fee will be indexed by the inflation. Let's view a PCORI payment cycle example. So, as a reminder, PCORI begins for plan years ending on or after October 1st of 2012. Let's say your plan ended October 31st of 2012. You will owe $1 times all the covered employees and covered dependents. You'll pay that $1 on July 31st the following year. So, your plan year ended October 31st, 2012. You will pay July 31st, 2013. For the plan year ending October 31st of 2013, you would owe $2. And again, always paying that July 31st of the following year. Calculating PCORI fees for the fully insured group. Fees are based on the average number of lives covered, and this includes dependents and COBRA continuees. Insured plans will submit the payment on your behalf and may use one of these methods. The first is the actual count method, where they'll take the sum of the lives each day of the year divided by the days in the plan year. Or the snapshot method, where the number of lives covered on one or more dates each quarter of a plan year is divided by the number of quarters. Lastly, the carrier may use their NIAC filing. This is the average number of member months that they report in their form to the National Association of Insurance Commissioners. Calculating PCORI fees for the self-funded employer. Self-funded plans, essentially the same. They'll submit their own payment, of course, but may use one of these methods. Again, the actual count method that takes the sum of the lives each day of the plan year divided by the days in the plan year. Or the snapshot method, again, the number of lives on one date or more than one date for each quarter of the plan year is totaled up and divided by the number of quarters in the plan year. Or lastly, if it's an employer filing a 5500 form, they may just submit the number of covered lives reported therein. Now, if you're an employer that has an HRA integrated with a fully insured medical plan, you will need to make a separate PCORI payment for the HRA. However, you need only count the employee contract and not the dependents. Again, this is just for the HRA piece. The carrier will submit on your behalf a PCORI fee for all the covered lives on your plan. How to submit your PCORI payment. PCORI is assessed and collected like any IRS tax. Plan assets may not be used to pay PCORI. Exceptions would be the multi-employer trust or a retiree-only VEBA, since they have no other funds. The PCORI fees are tax deductible as a business expense, and you will use IRS Form 720. Now that's a quarterly form, but you'll only be reporting and paying the PCORI one time a year, again, July 31st. This shows a link where you may view the form. Here's a glance at the Form 720. Looks like any IRS tax form. And in the middle, Part 2 will be the opportunity for you to insert your average number of lives covered and your calculated fee. Actions to take now. Well, did your plan year end between January 1st, 2013 and September 30th of 2013? If so, you owe the $1 fee payable this July 31st. Or, did your plan year end between October 31st of last year and December 31st, in which case you will owe a $2 fee times all the covered persons on your plan, and that again will be payable this summer, July 31st, 2014. That concludes our short webinar and compliance alert. A reminder from the attorneys, this compliance alert is not legal advice. Regulations and guidance is provided by Health and Human Services and is incomplete. Anything can change without notice. If you have any questions, feel free to contact me or your Apex account executive. Likewise, if you'd like a copy of these slides. There's our website and, of course, our number. Thank you again. We'll talk to you again soon.